Coming to the venous side, so we have like the commonest complication or the problem which patients encounter is varicose veins. So for that, what they do is like stripping or ligation. They tie up these blood vessels, and in order to avoid what is varicosity, which is a dilated and a tortuous blood vessel, especially the vein. So they dilate the blood vessel so that the blood doesn't move into it, and then it just gets obliterated. So we have procedures like ligation and stripping, and sometimes they just go within this vein, which is called as an endovenous ablation, and they are going to remove the incompetent vein. That is an endovenous ablation, or they are going to treat by way of a phlebectomy, meaning incisions are given into the veins. You will have to know whether how many such incisions are given, because we have codes for less than 20 stab incisions or more than 20 stab incisions. Sometimes they might also give you radiofrequency wave administration. So this might also cause obliteration of the blood vessels. Accordingly, you can select the codes.